Hopefully you take me along.
Yes, I'll think about it.
Sure.
Anyway, so today I want us to look at support systems. I mean, we've spoken about what breast cancer is, what people can do about it, but we've not spoken about the support they need and they should be getting. So how important is emotional and social support for breast cancer patients?
I mean, when it comes to the fight against cancer, and specifically for this month, breast cancer, then the support, when it comes to support, whether emotional, financial, from family and relatives, and the need for it cannot be overemphasized. It's very, very important. And this month, throughout this month, as we are talking about the screening opportunities available, the signs and symptoms, what to do, it's very important that we are wrapping up, that everybody that can hear us, listening to us this morning, if you know somebody who is fighting breast cancer, it's a call on all of us to support them, both emotionally and financially. And this also goes a long way to our various religious institutions, that if you are a church, if you are a corporate organization, and you have a member who is fighting breast cancer, now is the time to really show up for the person, because it takes a big toll on them. So the support system is very, very important.
Okay. So how can the loved ones support someone who has just been diagnosed with breast cancer?
I mean, it starts with just a simple message of we are with you. We are there with you. It starts with a simple message that everything will be all right. It starts with a simple words of encouragement that whatever it is, we are with you. So wherever you go. And then, not just by word of mouth, you have to be there for the person. So join them. Go with them to their clinic appointments, to their surgical appointments, to their radiology appointments. And the most important bit is the financial bit. It's the financial bit. So let's support them. It shouldn't really be that much. Whatever you can afford, just send it to the person to support them. Let's say don't you
think that sometimes people might think, telling people, they texting you, you sort of feel pity for them?
It does, but I usually say that if you were the one in that situation, what would you want others to do for you? The good book says that do unto others as you want others to do unto you. So if you were the one fighting breast cancer, what would you want your family to do for you? That's exactly what you have to do for our relatives who are fighting breast cancer. Yes.
So in your experience, how does positive relationships encourage and impact treatment?
It does a lot. If you have two patients, one of them comes with a husband, the other doesn't. The one that comes with a husband is always cheerful. The husband has first-hand information. So that's one advantage of being there for them. If you join them to their clinic appointment, you have first-hand information as to every stage that they get to in their treatment. You are there with them, and that really helps. And when it comes to the fight against breast cancer, it's not just even the patients, but the relatives at times even suffer more than the patients. Because if you distance yourself, you don't know what's happening, you don't know if there is improvement, you don't know whether there is no improvement, and you tend to even worry them more. So it's very important that we provide the support system. To that effect, we've even launched breast cancer survivors group in Kumasi here. Yes. Okay. So I'll confirm there's such a group.
It's difficult getting some. Because I had wanted to get a survivor today to come in, but it's not easy.
Yeah, it's all the stigma that comes with it. So I understand. But we've started such a group which is supposed to, gather and talk about it, support each other, go through the process. Once you see somebody who has survived it, it kind of motivates you to go through it, and you can also come out with a positive results.
So what role do healthcare providers like SACS play in providing psychological and emotional support alongside the medical care?
So we usually say that the treatment of cancer is multidisciplinary. So one person does not treat cancer. So apart from the medical treatment that we are giving you, we also provide the spiritual support. So we have chaplains that we will link up to help you with the spiritual bit. And we have psychologists too that will talk you through it. So we have clinical psychologists that will link you up to help you talk through it every step of the way. And once we have this team, we are able to give you the holistic care that you deserve. Yes.
So let's say there's someone here in my office that has breast cancer, or there's someone in my community who has breast cancer. How do we create a more supportive environment for people who are going through cancer treatment?
So first of all, no stigma. You shouldn't stigmatize them. So if you are in an office and there's somebody with breast cancer, it doesn't mean, I talked about the myth the other time.
Yeah.
It's not contagious. So you don't have to distance yourself from the person. Eat with the person. There's no way you're getting the cancer. Okay? Share jokes with the person. Have conversations with the person. Support the person. And if you're also privileged to be in managerial position, then you have to understand that there are days that they have clinic appointments that they might not be able to make it to work. There are days that because of the one treatment or the other that they had, probably they are weak and they can't come to work. So if you are in the same department, then you have to step up your game and help the fellow who is fighting it. So all these little things help with people fighting breast cancer. Yes.
Okay. And let's go to our message of hope. You know, when most people hear breast cancer, they get scared. What message of hope would you share with them?
So this morning and throughout this month, our message is very simple. The message is that breast cancer is not a death sentence, and the most important thing is to present early. So early diagnosis saves lives, early treatment saves lives, and now we have modern treatment modalities available that we can give. So if you can come to us early enough, then we have a lot of options for you and we give you the best of care. So if you are living with breast cancer at the moment, just know that with SACS, we are not leaving you alone. We are with you emotionally, spiritually, and as a hospital, we will do our best to support you. So you can come to us and we will link you up to all the necessary disciplines that will help you to get cured. Yes.
So from a medical perspective, how has treatment improved in ways that give patients a reason to stay hopeful?
Treatment has improved dramatically. I mean, gone were the days that we were giving one thing to all our patients. Now treatment is individualized. So as I said, you come early enough, they're a group that we won't even take off your whole breast. We just take the disease out. That's one improvement. All because now we have technology that can radiate that side for the cancer cells. We have treatments that target specific cells of the cancer cells and kill just the cancer cells. So that's how far it has advanced.
So if I get you, like, depending on your condition, each person and the treatment.
Each person and the treatment. So once we are done investigating and assessing you, we categorize you, and depending on your category, that's determines what we give you. So probably if you still want a child, the treatment we give you is different from somebody who's menopausal.
Okay.
If you come early, the treatment you get is different from somebody who comes late. If for a reason you want to freeze your eggs before we start treatment, all those things are available. So now we have modern treatment modalities for our patients to stay very hopeful and have a better quality of life. Yes.
Have you come across any success stories or recovery examples that
a lot.
Would you want to share any?
A lot. So I will talk about this young lady. She was in her 30s when she was diagnosed. By then she was newlywed. So it was very difficult for her and the partner. But with words of encouragement and with family support, they were able to go through the treatments, and she's doing very well. She has even had her first baby. Child is also doing very well, going on with her career and the family. So we have a lot of success stories. Just come to us, and I believe with God on our side, we can be positive.
Personally, I have met a few people.
Okay.
And I'm sure there are more out there. What message would you give to the women, those who have been avoiding screening out of fear or denial?
So it's all about taking the next big step. So I always say, not to scare you, but I always say that the fear of not knowing might even kill you than the fear of knowing. Because if you know, then you can take the necessary steps.
But you know, most of the time they'll say that if I don't know, I am okay.
You're not okay.
What you don't know can kill you.
It can. In this case, it can. Because if you don't know, it means you tend to come in late. And once you come in late, there's little we can do. So what I will tell our mothers is, don't shy away from screening. We are screening you because once we get the diagnosis early, we have better care for you. We can basically cure you once you get it early. So don't shy away from screening. Come in, let's screen you, and we have better treatment options for you. Yes.
Okay. How do you think survivors can inspire others who are currently fighting breast cancer?
It's all about sharing your story. It's all about sharing your story.
You know, some people don't hear your story and be like, oh, this is how it worked for you. What if it doesn't work for me?
I mean, it's not one cup fits all, but at least it motivates you. It motivates. So if you are a survivor, don't shy away. There are people who want to hear your story so that it will motivate them and encourage them to seek treatment. So the survivors that are listening to me, the message is share your story and let it motivate others. Yes.
Okay. Finally, before I come to the few messages I've gotten, what is your message to all listeners this Pink October about staying proactive, staying positive and hopeful?
So our advocacy doesn't end in this month. It's this month that we've thrown more light on it, but it doesn't end here. So all the various conversations we've had about breast cancer, let's keep it in mind. That screening is very important. At 2 or 3 days after every monthly menses, make sure you examine your breast yourself.
Okay.
At least twice in a month, come to the hospital, let's examine your breast. If you are more than 40 years, get a mammogram done. If you have a relative who died of breast cancer, then as early as 35 years, start your screening modalities. And together, if we are all heading towards one direction in the fight against breast cancer, I'm sure we can conquer it in no time. Yes.
Okay. I don't know if Liveman is asking this question for himself or for someone, but he's saying that at the age of 10, Doc, breast milk normally comes from my breast. I don't know whether it's breast milk or not. When I was 10 years old, is it normal? When I wear a shirt, that place will be wet. So let's say if it's coming from the left breast, when he wears a shirt, then that place gets wet.
I mean, the best is to come to the hospital and let's see you. But it could be normal, it could be abnormal. There are even some children who get breast milk.
Interesting.
Yes, I mean newborns who get breast milk. So come to the hospital. Let's have a look. It could be very physiological. It could be abnormal. So just come and let's examine you. Yes.
Okay. And Ivan, so please try as much as possible.
Yeah. So every Wednesday,
And
the
make
clinic
your
still
way there.
continues. Every
Okay.
Wednesday,
Okay.
8 to 11 a.m. Saks Small Clinic. We have a breast clinic going on. Yes.
Okay. Okay. Anyway, thank you so much, Dr. Owusu. But before you leave, we're asking this question. What is one thing you can never understand about women?
It's more than one. Oh.
You tell us. Tell us as much as you have.
I have to think through.
As many as you have, share.
So you see, there are some of them I can't really share because I'm sure the person might be listening to me. So there are some of them that I can't even share. But probably the one thing I'll talk about is what tickles them to cry. What tickles our ladies to cry. There are a lot of things that they will shed tears, and I mean you don't see the tail end of it. You just can't fathom why such a thing will tickle you to cry.
Hormones.
Hormones, yes. I usually say that. I don't know if there's a button somewhere that they just press
It's
and
hormones.
tears will flow. So, but we love you all the same because without you, we are not complete. Yes.
Okay, thank you very much, George.
Sure. And thanks for having me throughout this month.
Yes, it's been a pleasure.
Sure.